Hello there, and welcome to our presentation on multi-professional working, enhancing maternity services through research. Research at Cardiff and Vale University Health Board has changed. We feel that research here is paramount. Most hospitals have a core maternity research team already in place, and we felt like we needed to catch up. So we implemented a core research team to help this hospital conduct more research and raise awareness of research within maternity. Not only will this help improve care to our women and their families, but also bring essential funding to the unit. Prior to September last year, research was conducted sporadically by different professionals. An awareness of research studies was felt within the unit. As a tertiary unit, we were significantly underrepresented in the research world. We know that pregnancy and childbirth is a major life event, and research in this area is fundamental to enhancing women's experiences.
So why is research important? Evidence has shown that clinically research active hospitals have better patient outcomes. Women are always given the choice to be involved in our research, and using our evidence-based practice is paramount within our NMC guidelines and also throughout our values and behaviours as a health board. It enhances our patient experience. It improves our staff skills because they're utilising those evidence-based practices throughout their daily clinical interventions within their patient group. It increases our funding to help maintain and provide better care for women, and it also provides better and public and patient engagement. So within Cardiff and Vale Health Board and within maternity itself, we've had quite an impact on previous maternity research. So there's two research studies that we've looked at recently, in the recent years, who have actually made a massive impact into the care we provide as midwives and doctors to women within the health board. The BEMS study was a randomised control study that looked at finding out if positioning during the second stage of labour in women who is delivering their first baby actually made a difference to achieving a normal vaginal delivery. Our perception was as midwives that an upright position was more effective than a lying down position. And this study actually showed unexpectedly that a left lateral position was the most effective position, which has now been implemented into practice throughout. The second study that's really made an impact is the ANODE study. This was also a randomised control study to see if a single dose antibiotic given to a woman during assisted vaginal birth would reduce infection rates. The results were that women who received these antibiotics were less likely to develop an infection postnatally rather than those who received a placebo. And this equates to over 7,000 infections annually in the UK. And we now give routinely antibiotics to women who have an assisted delivery. So within our core research team, we've actually made four key areas for our vision. The first one was embedding a research culture into our department, strengthening our ties with the university, developing a network within other research teams and other health boards, and promoting multidisciplinary working.
Collaborative working is key to enhancing maternity research and improving maternal and neonatal outcomes. The woman is always at the centre of our care, and our MDT approach involves the midwife, the researchers, obstetricians, consultant midwives, the clinical board, and our head of midwifery. So, what have we achieved so far? Now at this hospital, we have a core research team, which involves an obstetric consultant lead, a Band 7 research midwife, and 3 Band 6 research midwives. We've opened 8 research studies within the obstetric unit, and we've launched a research office. We promote all of our research via Twitter, Facebook, and Instagram, and we hold live Facebook sessions on Facebook. We present all our mandatory training for all the multidisciplinary team. So we've embedded a research culture here at our unit, and the ways that we perform that is we've got a quarterly newsletter which gives everyone an opportunity to present any research that they have. We also promote research on our study days and via social media. We have a research engagement notice board, and that is open to all staff so they can pop any ideas or any queries that they have up on there. And we also offer the opportunity to one-to-one learning to all our staff, just in case anyone has got any ideas and they'd want to approach us about them. Strengthening ties with the university was another one of our visions. We have a very close working relationship with Julia Sanders, who's a professor of clinical nursing and midwifery. She can help us with applications for further research studies and the development of our own studies. Networking with other health boards is a key part of our vision. We have been able to make links with other research midwives across Wales. This was something that wasn't in place previously. We have face-to-face meetings to discuss upcoming research trials and any challenges encountered. This provides us with a really good support group, and we also have a quarterly research forum. Since the impact of COVID, we have been doing these links more via Zoom and Teams calls, but hopefully we'll be able to resume the face-to-face meetings in the future.
So what trials are we involved in the obs and gynae department over the past few weeks and months? Our big baby trial is looking at when and how we should be delivering babies who are measuring on the larger side. Our ear study is a twin study looking at how we deliver information and what information we should deliver to mums who are carrying more than one baby on board. The C-stitch study is looking at different suture materials and the outcomes from using those different suture materials. MSEP is a maternal sepsis study which has been done and brought in-house, and that's looking at biomarkers within bloods to see if we can identify any of those markers that would then lead on to sepsis. Pan-COVID has come about through our COVID pandemic. That's a worldwide study that we're really pleased to be a part of within Cardiff, and that's identifying women who are either symptomatic or non-symptomatic, or have had tests or not had tests with anything to do with COVID, and they can be part of that study and will inform a huge database of women. Our Diapan study is in the early inception of that. We're holding an e-registry looking at a different way of induction of labour for women. We do lots of induction using pharmacological methods, and this is looking at a mechanical way of doing inductions. A very recent trial we've just come on board with is the Wills trial, which is actually looking at how we deliver women with risks of high blood pressure within their pregnancy. And one trial you won't see on that list, and we will be adding into that, is actually we were part of a large health board audit called COVID surgery, looking at outcomes from surgical procedures relating to COVID and surgical procedures that were undertaken. So looking forward and how much we've done so far in the past year, but what we want to do is improve and go much further within our research and core research team. We really want to hold internal GCP training. So some of our midwives who are research midwives, they really want to get involved and learn that GCP training, and we can spread that information far and wide within the health board. We'd like to increase the number of studies, and we really would like midwives and doctors to become PIs and also CIs of studies, which can only enhance and improve our research culture within the department. We really want to support staff to undertake master's modules or spend some time with us as researchers or second into the research team, just to give them a flavour and a feeling of what we do within our research day to day, and hopefully get some more people wanting to become research midwives or nurses or doctors in the future. Student placements haven't happened with us within the department because we've been so young in the development, but it's something we definitely want to pursue and get students really keen and interested within research going forward. And we also want to do our own research, which is now starting to happen with MSEP, but there are lots of key areas within midwifery and within obs and gynae which we'd really want to explore and do some more research in-house for that. So our contact details are on there. You can contact any of us anytime if you want to pop in and see us. We're based in the midwifery-led unit within the hospital, within antenatal clinic. Our research midwives' email address is there and all our other contact details. If you ever need to speak to us about anything, just drop us a line. Thank you very much for listening to our presentation, and we'll hope to see you face to face next year. Bye.